Good afternoon, everyone. My name is Dr. LaTia Greer. I am a recent graduate of Walden University Behavioral Health Leadership Program. My chair was Dr. Harris, and my presentation today is on leadership experiences with organizational infrastructure in early childhood mental health consultation programs. So I'll give you a little background on how I got to this organization. Organization X, Y, and Z is in this study is a nonprofit agency, public agency located in the Midwestern region of the United States. Organization X, Y, and Z was founded in 1969 by a small group of politically active citizens that led by a young woman who advocated for affordable childcare and early learning options for low-income families. In the mid 1980s, they started out as a very uh, grassroots agency looking for advocating on certain initiatives regarding the availability of quality childcare. Organization X, Y, and Z has since expanded its services and programs to reach over 4,000 advocates, 93,000 providers and centers, and 150,000 families and children a year. The organization offers an array of early childhood education programs and services, as well as resources to support early learning providers, educators, families, and community partners as well. The organization provides programs, services, and advocacy to address root causes contributing to endemic poverty by improving the learning and life outcomes for children and their families. Organization uh, XYZ is dedicated to ensuring that the experiences that the children actually experience are beneficial to their growth and their development. In addition, they take part a part of advocacy and research as well, creating policies and legislative practices to improve the quality of life for every child. Their advocacy has led to many different things. They are now like 8 locations. They have now have 8 locations. Each of their divisions are divided into 4 different agency, well, 3 main agency functions, and that is advocacy and policy, evaluation and research, and program design and development. And so altogether now they have 23 programs over the years. So they just celebrated 50 years, probably about a year ago. Organization X, Y, and Z, a leadership team, had some difficulties creating buy-in for their services, not only to the management, but also to the community in which they are providing the services. The organization, the purpose, I'm sorry, oh, cited a lack of buy-in and implications of the problems related to program design, implementation, and management of its early childhood mental health consultation school-based program. The leader noted ambivalence to changes required for the organization's infrastructure to support the evaluation, the program, and the changes that the organization had actually, actually had experienced or implementing. The program's implementation has been plagued with frequent changes, delays in decision making, typical behaviors that should be a little bit more smoother. They were having issues with that. The significance of this program was to decrease the amount of endemic poverty that exists. And so they have been able to do some of those things. However, they were having a difficult time with the outcomes and explaining those outcomes. The theory that I used was the Baldrige Excellence Framework theory. And that allowed me to try to assist the organization with finding different and alternative ways of making sure that they built a quality program. Go to the next slide. So again, the social impact of the issue was to prevent endemic poverty by creating environments that are conducive to learning and improve childcare and learning throughout the child's lifetime and the lifespan, and also to help the to help the family as well with coming up with different um, alternatives to ensure that they had everything in place in order to help those people. That's the next slide. Some of the research questions that were asked was quite a bit regarding some of the infrastructure, some of the things that they had done before regarding some of their mission, regarding their mission. So how has the early childhood mental health consultation program aligned with the organization's vision and mission? What was the experiences of implementing strategies? Like what had they tried before in order to make this program work? Because they realized they were losing money. And this program in particular was actually is more of income-based versus grant-based. So they were losing a lot of money. So that was some things that needed to be asked. As a leader within an organization, what has been your experience with building an effective and supportive work environment? What the organization's leadership and governance engagement strategies were, and how did the leaders see their role as influencer of change in the organization's culture. Structured interviews with the behavioral health leaders were conducted with a couple of the executive team members. Also, there was some participation and surveys that were conducted with the community as well. And so those structured interviews were categorized. And so there were a couple of things that came up out of those interviews. You go to the next slide. The results of the study could inform organizational leaders about the solutions to address the resistance to change. One of the things that I did notice that there was a resistance to change. And a lot of that had to do with some of the things that came up as far as the organizational change and a response to change. As far as change management, one thing that was learned was that there was not a change management plan. And so when things did change or the organization did experience changes, they did not have a written plan for it. It was just something that they would just deal with as it would come. And so they didn't have that change. And then that response to change was big, knowing that a lot of the changes that were taking place were not necessarily written down. They were just changes that would happen. And then people were kind of resistant to doing things a different way versus the old way. Another theme that came up was buy-in. And buy-in is definitely imperative, but it was on two levels that they could not obtain buy-in. And that buy-in was from their leadership, because the leadership did not believe that, although they believed that the program was worth running, because it did not show them any type of financial increases, they decided against it. And so during my study, the program was actually shut down because they did not believe that it would be beneficial monetary wise. So the other theme was the leadership role, being responsible for creating an environment, the leadership not understanding their role, not understanding what their role was as far as engaging other people. And a lot of those things came from best practices, not having best practices in places, a lot of different changes that would occur, um, a lot of different changes that would occur, and no one would have them written down. So a lot of those things came with the leadership's role in trying to understand what that leadership um, role was. Next slide. All right. So the interpretation was that this study actually could help others who are trying to implement this program in learning what the limitations of the program, what the limitations of the studies was, although it was small, it was a small study, so that they could interpret it and try to use it where they are, if that makes sense, in other settings. This setting in particular was in a school district, but to utilize these same recommendations will be very beneficial in other settings as well. So one of the recommendations was the behavioral health leaders develop best practices and maintain accurate records to monitor the performance of the program. Also consider changing the leadership style. They did have a very rigid style of thinking, not a lot of um, gaining knowledge from the other people, the actual consultants who were working and doing the actual study. I mean, actually doing the work. So learning from them would be very beneficial as a shared governance. Also develop a solid evidence-based model that is design-led and strategic plan, making strategic plans so that they could create a continuous improvement plan for feedback so that they know what they need to do next and how can they improve their structure. So again, the structure, the social implications was may provide behavioral health leaders with strategies to access alternative financing to generate revenue, additional revenue outside of just the grants. So next slide. Next slide, please. So are there any questions? Sorry, this sounds like it's quick.
And just to jump in real quick, hello everyone again, this is Brandon, your moderator. At this time, I invite you all to come off camera or unmute yourself or utilize the chat feature. We are taking any questions that you may have for Dr. Greer here. And I have a question for you while we wait for any participants to formulate their questions. What is one bit of advice you would give to a Walden student who are in this stage of their program and considering their research?
Well, I guess slowing down the process. It took a while to really get an understanding of the entire process, but it comes together at the end. Although you may not see it right at the beginning, just keep, I guess, digging into it, and just being like, becoming one basically with your study and just knowing it from the inside and out. That process kind of helps you slow it down.
Mm-hmm. Is there anything about this process that surprised you during your research?
Oh, wow. Probably that initially, and I think again I have a bachelor's, I did my master's, and kind of seeing it all kind of come around full circle from when the first time I said I didn't like research, that now I'm very interested in the research. So just I guess just having a better an appreciation for the research now.
Looking at the chat here, I see we have a question here from Dr. Andrea Harris. Do you plan to continue using the information from your research? And if so, how?
Yes, I have, well, actually with the program that I actually did the study on, there continues to be a lot of research around better ways of, I guess, building out quality programs. A lot of this um, because of the challenges that they face in early childhood. This will actually be contributing to how leadership looks at developing those programs and how they plan on implementing them as well to make sure that they are of quality and they're not just things that we're just checking off a box for.
Thank you. I have another question here in the chat from Dr. Melissa Schuler. And feel free to follow in the chat too if my reading jumbles a little bit. Great job, Dr. Greer. My question is, did you experience any challenges with the BHL giving the resistance to change and noting that a change in leadership style would be beneficial to the organization?
Yes. So yes, there were a lot of things that the uh, behavioral health leader did not believe she played a role in, if that makes sense. So it was almost kind of looking over at every, looking over at everybody else and saying it must be something down there. So yeah, with understanding that change does come, there were a lot of things that that behavioral health leader didn't want to change as well. And there are quite a bit of things that didn't change, which was why the program kind of diminished the program. I think they're going to try to bring it back up. But again, it just depends on, how they're doing the research and how that looks as far as building out that program.
Thank you. At this time, I do not see any additional questions here for you. So again, Dr. Greer, thank you for sharing your presentation with us, your expertise.